Welcome to lesson 6.2. In this lesson, we are going to step back and look at what would happen if we took a broader view of health and looked at the other sectors in the government to help out or collaborate with the Ministry of Health to improve the health for everyone. So let's start here. Can the Ministry of Health alone address all the health issues in a country? And I want you to go back to the beginning of the chapter, chapter 19, and read those mini case studies on some examples of how including other sectors in the government can help improve health. So what we're talking about is intersectoral approaches. And these are actions undertaken by sectors outside the health sector, possibly, but not necessarily in collaboration with the health sector, on such issues as health or health equity outcomes, or on the determinants of health or health equity. So when you think about the intersectoral approaches, it actually makes you start thinking about this is actually the social determinants of health. And any effort to consider these different approaches can improve population health needs by starting to examine why people get sick in the first place, why do they die, why do these conditions exist, and so really taking a step back and looking at the determinants of health and those key risk factors. And we've already talked about social determinants of health already. So we know there's, individual lifestyle factors that have a direct role on someone's well-being. We also have some other areas that have an indirect role, like level of income, level of education, stigma and discrimination, gender norms, and then taking a step back even further to look at the government policies and programs and how they're implemented and how they exert an important influence on the health of individuals and communities. So thinking about such things as, does the government promote high quality schooling for its children, including female children? Does the government promote access to safe water and sanitation? Does the government seek to promote a fair society in which everyone has equal opportunities to live and thrive? So these are, again, as you recall, the social determinants of health, the conditions in which people are born, grow, work, live, and age, and the wider set of forces and systems shaping the conditions of daily life. These forces and systems include economic policies and systems, development agendas, social norms, social policies, and political systems. And so again, this is the importance of looking at health from not just the health sector, but from the other sectors as well within a country and within their government. So when we think about whether people are healthy or not, we need to take into account the most important risk factors. And so this table looks at the top most important risk factors for DALYs in low-income countries, upper middle income, and high-income countries. And you can see in the lower middle income countries, we're looking at some maternal and child issues, but in the upper middle and higher income countries, we're looking at those non-communicable diseases. We're looking at the risk factors for those. So hypertension, smoking, obesity, high blood sugars. But over here in the low income, you're looking more at household air pollution, environmental issues, unsafe water, unsafe sanitation. And so if we were to look at the most important attributable risk factors for DALYs, this is what they would include: undernutrition, dietary risks, high blood sugar, obesity, unsafe sex, tobacco use, alcohol use, lack of water, sanitation, and air pollution. And so as you start thinking about these risk factors, you can actually start to categorize them into different categories. They can be intrinsic risk factors related to your age, sex, and genetic makeup. And these can't be modified, but really do have an important part or relationship with well-being. You can look at diseases as risk factors for other diseases. So some diseases are risk factors for other diseases, such as diabetes is a risk factor for cardiovascular disease. Behavioral and environmental risk factors. Is the individual a smoker? Do they have a high alcohol use? What is their diet like? Physical activity? What about environmental risk factors? Thinking about what type of environment do they live in? Do they have a high amount of household air pollution? Is there an issue with significant climate change? Are there tornadoes and tsunamis? And so looking at environment as a risk factor. So this is a really interesting table, specifically looking at behavioral or environmental risks and the risk factors associated with those, including the number of deaths globally. So you can see, remember from our global burden of disease tool that we use, remember deaths and DALYs are divided into three categories: communicable diseases, which includes the maternal and nutritional conditions, non-communicable diseases, and injuries. And if we look at the proportion of deaths that are related to behavioral or environmental risk, we can see that 30% are in this category, 24 and 20. So of the 30%, what are the concerns? Unsafe water, sanitation, and hand washing. Maternal and child nutritional risks, unsafe sex, air pollution, tobacco, smoke. For non-communicable diseases, again, all the risk factors that we think of for our non-communicable diseases: smoking, low physical activity, dietary risks, and then injuries are related to alcohol and drug use. So this is a great picture here about industrial pollution, which is a major public health hazard. And so if you were to ask the questions, what measures can be taken to reduce the public health impact of industries that are major sources of pollution, and what agencies must be responsible for leading these efforts? It's not just the health department. So these are the questions that we ask ourselves. What is the extent to which the determinants of health and critical risk factors can be addressed by the actions within the health sector? And then the opposite is, what is the extent to which they can be addressed only through agencies outside the health sector or by those agencies in collaboration with the health sector? And we're going to look at some of those categories that we looked at, as well as the risk factors. So now we're going to look at the role of intersectoral approaches in addressing the determinants of health and health risk factors. So we're going to look at a couple of key areas. One is we're going to look at the risk factors related to fetal development. So factors related to newborn development are complex, and they're impacted by such things as nutritional level, educational level of the mother, income status of the mother, whether or not the mother smokes tobacco or engages in the abuse of other substances, the access of the mother to prenatal care, and a delivery attended by a skilled healthcare provider. So we know the Ministry of Health is responsible for prenatal care and skilled attendance at delivery. However, the other factors are related to other agencies. Policies related to the Ministry of Agriculture have a strong influence on nutritional status. Educational status of the mother will depend largely on the degree of the Ministry of Education. The Ministry of Health, Finance, and Law Enforcement can oversee policies on substance abuse. So you can see how the intersectoral approaches are really important when we're looking at health. What about diseases as risk factors for other diseases? So we know some diseases are risk factors for other. We've already talked about diabetes related to cardiovascular disease, and we know that HPV is a risk factor for cervical cancers. And so such diseases have risk factors themselves, and they're both social and behavioral in nature. So if we think about HPV, we know unsafe sex is a risk factor for HPV. And we know that a sexually transmitted infection is a risk factor for cervical cancer. Unsafe sex is also a risk factor for HIV, which can also relate to a number of other diseases, and there's a coexistence between HIV and TB. And so the health sector can implement health promotion activities that encourage a monogamous sexual relationship, encourages the use of a condom to promote safer sex. Medical male circumcision has been on the forefront to decrease the transmission of sexually transmitted infections. But there are some aspects of unsafe sex that can only be addressed outside the Ministry of Health. And one would be looking at women, the ability of women to negotiate safe sex practices. That relates to her level of income, her level of education, and her social standing, which is strongly related to societal gender norms. And so, if you were to take a step back, you can see that these factors are determined largely by matters outside of the health sector, such as policies that promote gender equality and girls' education. And so, looking at those intersectoral approaches. Many social and behavioral risk factors also must be addressed by going beyond the health sector. For example, when addressing safe water and sanitation, health ministries can encourage certain health practices, such as, washing your hands before eating and after defecating. But it's the Ministry of Urban or Rural Development or of the Civil Works that's generally in charge of water and sanitation infrastructure. Here you have women in India, which are continuing to get their water from uncovered wells or open sources. And this contributes to dehydration related to diarrheal disease. And so the Ministry of Health can promote safer use of water, better sanitation, and hand washing. However, it's not responsible for investments in water and sanitation. Another big one is tobacco smoking. So we know tobacco use is the leading risk factor for death and disability across the world related to cardiovascular disease and cancer. And so from the health ministry point of view, they can engage in health promotion to discourage tobacco use. They can also provide counseling services for patients and prescribe nicotine replacement therapy. However, there is a lot of evidence that the best way to reduce the uptake and consumption of tobacco is through taxation of tobacco, which is naturally controlled by the Ministry of Finance. And other areas that we've seen in Canada is looking at reducing the consumption of tobacco, such as banning advertisements and banning sales to minors and reducing the hours for sales of tobacco. And these are led by sectors outside the health sector, such as law enforcement. There are several ways in which countries can organize themselves to address health issues that require this intersectoral approach. One approach that you'll see in the literature and in the required reading for this week is called the Health in All Policies, or a whole government approach. And so in this case, all the ministries in a government are required to account for the health implications of their policies, plans, and programs. And remember when we looked at the case study of the state of Kerala, think of all the different sectors that came into play to improve health. So they had the improvement of gender equality for women. They made sure that primary education and secondary education was available. They had a real focus on immunizations. Then there was a bigger focus from not just the health department looking at the health outcomes of their people, but it was a lot broader than that. Governments also might gain a better understanding of the intersectoral actions needed to address some of these health issues by carrying out a health impact assessment. And this is used to examine the health consequences of activities across a range of economic sectors. And the findings will provide policymakers with information to maximize the positive effects of investment and minimize the negative effects. And so one example they give in the book is looking at investment in roads. So investment in roads might produce substantial economic benefits, but at the same time, the construction of the road and the road itself might be associated with pooling of water. And we know pooling of water
can harness an increase in mosquito-borne diseases or an increase in traffic injuries. Another example I like from the book is the use of fertilizers and pesticides. We know they can produce a larger crop yield, which can help address undernutrition and improve young child health. But we also know that if not used properly, these chemicals might lead to poisonings among some of the people who handle them. And so, really, looking at this broad perspective, bringing together a wide range of stakeholders, examining whose health is likely affected, and provide that data-driven recommendations or evidence-based practice. So, what are the key main messages? It's important to share the determinants of health and health risk factors outside of just the health sector. One way is to engage in intersectional action through a health in all policies or the whole of government approach. Countries with less administrative capacity, such as the low middle income countries, can encourage agencies to work together on selected health issues. A health impact assessment is one way to identify and mitigate health issues related to economic and social endeavors, and it can guide this intersectoral approach. And lastly, it's really important that in order for us to address the burden of disease, especially in low middle income countries, that it requires a holistic approach to identify what are these determinants, the risk factors, and then identifying the efforts that need to be taken to address these key health issues together and not just by their Ministry of Health.